In Sierra Leone, the post-conflict period, I think in one of our research reports we described it as firefighting, because that was the best way to describe the approach that was taken to health system strengthening. So across the board, that was the approach, and unfortunately the importance of gender was not adequately captured, even though it was mentioned in the National Health Strategic Plan that they should try and ensure services are there for women and children. But when it comes to the actual implementation, it was not really clear. If you look at the maternal mortality rates from Sierra Leone during the conflict, right up until 2008, 2010, it's always been on the high side. In the early 90s, that was when the conflict started, we're talking 1,300 deaths per 100,000 live births. So that it's been always high. And then after conflict, with the effects of conflict where health facilities, infrastructure is destroyed, the health workforce was affected in a negative manner. It was no surprise that health services was also compromised. And in 2010, the maternal mortality rate was 875, which is one of the highest for Africa. And that led to an international report where Sierra Leone was described as the worst place to be a mother, the worst place to be born. And that brought about a lot of dialogue with the politicians and the international community, and that led to the implementation of the free healthcare to remove this financial barrier for the target groups of pregnant women, lactating mothers, children under 5, to give them access to the health facilities. But then in the demographic health survey of 2013 reported a maternal mortality rate of 1,165. So it's gone up. And if you look at the free healthcare, I think a lot of emphasis was put on service delivery, producing MCH aides, which are locators of health workers to deal with the increased traffic of the target group coming through the health facilities, but not so much looking at the bigger picture, not looking at things like trying to increase the number of qualified midwives. So a lot of focus was put on trying to produce these locators of MCH aides to address the increased service utilization. At this point in time, not a lot, but there's still an opportunity there because the recovery plan has been divided into segments. So there's a 9-month plan, a 24-month plan, and up to 5 years. So after the 24 months, there's another time frame that takes it up to 5 years. So in the initial documentation now, there's no emphasis on gender, but the opportunity is still there because lessons should be learned. And hopefully, as we move forward with the interest being raised about the importance of incorporating gender into health system strengthening, the decision makers will hopefully listen and try to incorporate that. I think it's just talking about it. You talk about it and eventually somebody will hear about it. So, because there's this general conception that it's not seen as that much of a problem with the decision makers. And I say that because the resources being invested into, for instance, dealing with gender-based violence is not adequate by any means. So I think it's if the international community can just talk about it when they go for these meetings and when they engage with the ministry officials, the decision makers, keep talking about it. We heard earlier that there was I can't remember which country it was, where every meeting it was mentioned gender. So if you keep doing that, eventually somebody will listen, and hopefully the right measures will be taken to ensure that it is incorporated in a timely manner. They should go in understanding the context, which you may not necessarily have if you're coming from the outside going in. So it's to going understanding the context and ensuring that they support these community-based organizations, so using more of a bottom-up approach, because they will give them a better understanding of the context and they have the advocacy voice to ensure that the issue of gender and how important it is to be incorporated into health system strengthening, then hopefully with the continued dialogue, that will be implemented at a later date. But then it's that assurance that the advocacy platform is there and the decision makers will listen. And with the international community falling in line with that, if everybody's falling in line with gender, with the idea that gender is important, then I think it's a step in the right direction.